Well, good afternoon, everyone. Today's our briefing for August the 24th, 2020. Want to just start off with some numbers. As always, we have our ASL translation, of course, with Paola, and we do always have our Spanish translation at the end after there's any questions from the media. As of today, we have 10,147 residents that have tested positive for COVID-19. We reached the 10,000 mark very recently, we expect about 9,000 of those have already recovered, which is always good news, and that of course cycles out as people get better. Our positivity rate is right at 8%. That's about where it's been. We've been around 8. We dipped a little bit below 8, but we're right at 8%. Now that of course is significantly better than where we were weeks ago and months ago at the peak. We know that the state of California wants us to get below 8% for an extended period of time. And that really means that we are cutting down on community transmission. And so that's a number that's important. So I'm really glad that we're there, but we need to get that number even lower. And so thank you again to everyone for their hard work. The good news is that we have not been going up on the positivity rate. We've stayed right around that 8%, but now let's get it even lower. We've lost, of course, also now over 200 residents. We're at 203 residents to COVID-19. We passed that 200 number also, of course, just a day or two ago. And 133 of those fatalities were long-term care facilities. Want to remind folks that one thing I think we're the most really proud of, and the health team is our robust testing program. The city does now in the capacity for 1,600 free tests a day. These are for folks whether they have insurance or not. That's the most daily tests we've ever done. And that includes our testing partnerships with the state of California, our partnerships with our harbor department here for our special testing center for port workers and truck drivers, and of course our partners with Long Beach City College and their locations and so many others. And so we're really grateful for the school district and for all of our partners with testing. We have available spots every single day. So please, if you need to get tested, if you have symptoms especially, get a test. I want to also just acknowledge and take this time to think about how much communication your city has been trying to do on COVID-19. We take this responsibility seriously. Today actually marks our 55th press conference and briefing related to COVID-19. So we've done 55 of these. Our first COVID-related press conference was on February 27th, well before the city's first case, and I remember that well, when we still didn't know a lot about COVID-19. The health department had been monitoring even before that, back in January. But throughout this public health emergency, we have strived to keep you informed. And this, of course, has included our weekday updates that we've been giving at least weekly. We've done more than 120 press releases and notices. We, of course, have put together multiple web pages and information in multiple languages. We've provided direct information to the community through newsletters and online stories. And our hotline has answered more than 25,000 calls at our 570 info line since we established it on March the 9th. Another 2,500 calls have been answered to our business hotline, which is the 5704-BIZ from business owners. We've, of course, placed signs across the city. We've done thousands of social media posts. And, of course, we've managed requests from all over. I mention that because it's important for folks to know how much the city has had to shift during the COVID-19 pandemic. A lot of folks across the city organization that used to do a job now do a different one. And the job that we're doing now is much more related to ensuring we get past this health crisis. And so as we continue to learn more and get further along, we hope also the city can begin to get back to some of its full work and full scope that we were doing even before the pandemic hit us. We know, of course, that the COVID-19 crisis is not over, and there's still a lot more work ahead, and we'll continue to keep folks updated. We want to also just let folks know, I've been getting a lot of questions around variances that are happening across the state, You may have saw that some counties have hit their state variance being under 8% for a couple of weeks. We, of course, are not there yet. We have a long ways to go. And there is no indication yet from the state about when it's safe to reopen any type of industry. And so we are in a holding pattern, and will continue to be so as we keep more and more folks safe. And people probably know that Long Beach Unified School District, of course, is continuing to go virtual, as are all our institutions around higher ed for this fall semester. And lastly, I want to talk also on some of what we're doing, the business relief that's happening. We are seeing tons of more of information from our business owners about what they need, and we're trying to get them what they want as it relates to COVID-19. Now I want to turn this over to a bit about the census. COVID-19, believe it or not, is having an impact also on the way we collect the census. We know that there's a national shortage of census workers. We know folks are less inclined to open their door and to talk to census workers. And so we are really at a crisis point across the country. Right now, Long Beach, at this point in the last census count, we are behind the count where we were even 10 years ago. We need to fill out the census. If you have not filled out your census, please take 5 minutes and fill it out by going to census.gov, or you can file by phone at 844-330-2020. Please know that in order for us to get health funding, COVID funding, funding for our schools, for public safety, we need a full, complete census count, and there's not a lot of time left. So if you haven't done so today, please fill out your census. I also want to note a change that we normally do 2 briefings a week. We're going to go back down to 1 press briefing a week, which will be weekly. It'll be every Monday at 3 p.m. We'll keep those live and open it up to the press. But dependent on circumstances, we will add more throughout the week if we need so. So if there's a big announcement from the governor, let's say as it relates to part of the economy or big news as far as the reopening, we will add these updates as needed. But for now, we will just keep these now to Mondays at 3 p.m. to keep folks informed. Of course, our longbeach.gov website, the COVID website, is up every day. And anytime there's a question that needs to be asked, those can go to our Joint Information Center. And so now I'm going to turn this over to Emily Holman, who is our Communicable Disease Controller on COVID, all issues COVID-19, and then we'll take any questions. So thank you, Emily.
Thank you, Mayor Garcia. Last Friday, we hit an unfortunate milestone in terms of communicable disease in the city. As Mayor Garcia mentioned, last Friday we marked our 10,000th case of COVID-19 in Long Beach, and we've now reported over 200 deaths here in our city. At the beginning of COVID, we had a lot of questions about COVID versus flu and how they sort of compared. So I kind of wanted to come back to that and mention, normally with seasonal flu, for example, last season, we received about 2,000 or 3,000 cases of seasonal influenza here in Long Beach, again, compared to just 10,000 cases of COVID-19 in just about 5 months, really. And also in terms of deaths, this last flu season, we reported 11 deaths compared to, of course, over 200 now here in Long Beach. So that kind of gives you an idea of how severe COVID is compared to flu. And no other communicable diseases has reached this number of cases before, especially in such a short period of time here in Long Beach. So with this new landmark of 10,000 cases, we really have spent some time in our surveillance team looking at the data and really looking at underlying conditions and who's more likely to develop COVID and who's more likely to develop severe illness. So first, I'll talk about underlying health conditions. So what we did, we divided all of our cases into a group of less than 65 years old and then 65 years old and greater. So we kind of compared the two groups. And I'll start with the younger age group, so those under 65. Among that cohort, the most common underlying health condition is smoking or vaping, which was a little surprising to us. So either those people had a history of smoking or vaping, or they currently smoke or vape. And that accounted for nearly 30% of our cases in our under 65-year-old cohort. The second most common underlying health condition among that age group was hypertension or high blood pressure and diabetes, and also asthma was a big one too. Compared to that, we looked at also those over 65, and among that group, hypertension was by far the most common underlying health condition, followed by diabetes. And then finally, among our deaths, we looked at underlying health conditions, and almost everyone in Long Beach who's passed away from COVID-19 has had at least one underlying health condition. Among our deaths here in Long Beach, nearly 60% of those who died had hypertension, so again, high blood pressure, and just under half, 42%, had diabetes. And the reason we really want to emphasize these underlying health conditions is that millions of people have hypertension, millions of people have diabetes. These are very common underlying health conditions. And so we want people to understand it's not just those with existing critical conditions who are developing severe disease or dying from COVID-19. Finally, in terms of the data, we also looked a little more deeply into our hospitalization. So one thing we noticed is that our overall average length of hospitalization among all of our COVID-19 patients was about 11 days, so a pretty significant hospital stay. About 60% of patients admitted to the hospital were under the age of 65 in the past month. And that's important because if you look back 2 months ago in May, it was just around 40% of those hospitalized were in that younger age group, so less than 65. So that's been a big increase. And this data confirms what our health officials have been sharing over the past several weeks, that we are seeing severe disease in people who are younger compared to earlier on in the epidemic, and there are a wide range of conditions and behaviors that increase a person's risk of developing severe illness. The last thing I wanted to talk about today, it's been in the news quite a bit, are the long-term effects of COVID. And it's only been around for 8 months as a virus that we've known about, but we're still learning more about people who were infected months ago and the potential ongoing conditions they may have. So new research shows that there may be a subset of people who had COVID months ago but are still feeling the effects. And this includes cases who were never hospitalized. So maybe someone who was sick at home with a fever, cough, shortness of breath, and recovered on their own, not necessarily severe illness in the hospital. Symptoms that we're seeing include severe fatigue, brain fog, which means it's just hard to concentrate, ongoing shortness of breath, joint pain, and other symptoms. We've also seen that previously hospitalized patients, so those with more severe disease, are also experiencing ongoing damage to vital organs such as lungs and the heart, even after they've been discharged and months after their hospitalization. So all this to say is this virus is still so new and there's still so much to learn. And these long-term effects associated with people with even just mild illness is another reason why you want to try and avoid it at all costs. So in closing, given the data we are seeing now and the new research coming out, remember that the sacrifices that you make every day, whether it's wearing a mask, staying away from groups, the physical distancing, these actions can save lives. Whether it's your own life, maybe you have hypertension or diabetes like millions of others, or you could be saving someone's life who's close to you. So let us continue to be vigilant, and we look forward to hopefully seeing a continued decrease in our numbers. Thank you.
Thank you, Emily. We will now take questions from the media. First question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi, my question is for Emily. So can you give, I guess, a more detailed breakdown of age groups in terms of like what underlying conditions there were, or were the main trends really just like below 65 and above 65?
Yeah, we did break it down further, but the big sort of delineation we're seeing is the under 65 versus over 65. That really sort of made the most amount of impact when we were looking at the data.
All right, thank you. Next question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. So you guys talked a bit about our testing capacity, but what can you tell us about the demand for testing? Is it going up or down as cases decrease? And are we still seeing the same amount of people daily as we were, or getting tested daily as we were a month ago?
Yeah, it's close. I believe it's declined a little bit. Yeah, so the demand for testing has declined if we compare it to sort of like mid-July when we really reached our peaks. But we are keeping up with the demand we have.
All right, that concludes questions. We will now go on to Spanish interpretation.
Muy buenas tardes, gracias por acompañarnos esta tarde. Este es su resumen en español del 24 de agosto. Hasta el día tenemos 10,147 residentes que han salido positivos del coronavirus y aproximadamente 9,000 personas ya se han recuperado. Nuestra tasa de positividad desde el 8%, ligeramente superior a la semana pasada, pero sin embargo estos números no se han alentado. La tasa de positividad aún está por encima de donde debe de estar para considerar cambios significativos en la orden de salud, pero han ido mejorando constantemente desde mediados de julio. Lamentablemente hemos perdido ya más de 200 residentes en la ciudad de Long Beach por el COVID-19 y 133 de estas muertes se han sido asociados con centros de atención enfermería de largo plazo. Hasta el día todavía seguimos haciendo hasta de 1,600 pruebas al día en la ciudad de Long Beach. Sí hemos visto la demanda un poco más baja, pero estamos siguiendo muy bien con la demanda que tenemos en estos días en comparación del mes pasado de julio. Un poco de detalles de nuestra seguridad comunitaria. Sé que la gente está ansiosa por reunirse, reabrir negocios cerrados y volver a las actividades anteriores a COVID, pero debemos seguir cumpliendo con las órdenes de salud. Esta es nuestra responsabilidad como ciudad para proporcionar información. Queremos platicar un poco sobre todo lo que hemos estado haciendo desde el principio de todo del virus. Tomamos esta responsabilidad muy en serio y hoy marcamos nuestra conferencia de prensa número 55 relacionada con el COVID-19. Nuestra primera conferencia de prensa fue el 27 de febrero y emitimos nuestro primer aviso público para crear conciencia a pesar de lo que no se habían reportado casos activos en la ciudad de Long Beach. Y por supuesto, nuestro Departamento de Salud estaba monitoreando la situación a partir de enero. Me ha impresionado la visión del departamento y todos los departamentos de la ciudad por su capacidad para adaptarse y satisfacer las necesidades del público durante esta pandemia. Queremos nomás expresar nuestra gratitud sobre todos los empleados porque un día están haciendo un trabajo y desde que empezó todo esto ahora hacen otro trabajo completamente diferente en la ciudad. Cuando se anunciaron los primeros casos presuntamente positivos el 9 de marzo, nuestro Departamento de Salud ya había activado su centro de operaciones del departamento y estaba preparando para realizar un seguimiento exhaustivo de los contactos. Hemos hecho más de 120 comunicados de prensa y avisos públicos relacionados con el coronavirus, incluido en la información sobre servicios, apoyo y ayuda a la ciudad. Varias páginas de web con recursos y información de salud, de servicios actualizadas y también periódicamente haciendo los datos más al tanto del día a día. Más de 25,000 llamadas atendidas a través de nuestra línea directa del centro de llamadas que se llama, que trabajan afuera del Departamento de Salud, cientos de entrevistas con los medios de comunicación sobre el coronavirus, cientos de publicaciones en las redes sociales como Twitter, Facebook y Instagram. También hemos respondido a más de 1,000 mensajes directos a través de las redes sociales. Y con decir eso, continuaremos dándole lo más información que podamos al tanto el día a día para actualizar y la más precisa sobre el estado del coronavirus en nuestra ciudad. También quiero tomar unos momentos para dar unos datos sobre el Census 2020. Los trabajadores del census llamados enumerados han comenzado a visitar las casas de personas. Aún si no han completado ustedes su formulario del censo, por favor tomen poco tiempo, dura no más de 5 minutos para llenarlo. Recuerden que esta información es muy importante para poder garantizar fondos para cuando tengamos emergencias como esta. y tengamos recursos. Es muy importante que contemos a todas las personas que viven en nuestra ciudad, en nuestros condados y todo nuestro estado de California. Recuerden que el Departamento del Census nunca les va a hacer preguntas sobre su banco, nunca le van a pedir dinero, nunca le van a hacer preguntas sobre su número de seguro social, no importa su estatus inmigratorio tampoco, para que tengan vigilancia cuando alguien venga a su casa a tocar o le llamen por teléfono. Nunca le van a pedir información personal. La información recopilada para este censo, otra vez, sea por línea o en persona, nunca se va a compartir con otras agencias tampoco. Por favor, si no la ha llenado, por favor visite a census.gov para presentar su solicitud en línea o también puede llamar al 844-330-2020 para presentar la solicitud por teléfono. Es rápido y fácil para completar toda la información. El censo está disponible en inglés, en español y también en 12 idiomas adicionales. Calendario, vamos a hacer unos cambios con nuestro calendario de las conferencias de prensa. Nomás queremos anunciar que a partir de hoy vamos a considerar solo una rueda de prensa semanal. Todos los lunes por la tarde a las 3 como hoy realizaremos estas sesiones informativas en vivo para mantenerlo actualizado sobre el coronavirus en nuestra ciudad y lo que estamos haciendo para combatir este virus, mantener a las personas seguras y mantener al flote de las empresas. Dependiendo de las circunstancias, claro, realizaremos más conferencias si lo vemos necesario. También queremos recordarle que todavía pueden llamar al 562-570-INFO los 5 días de la semana entre las 9 y 5 con preguntas sobre el coronavirus. También queremos platicar un poco la directora que nos acompañó hoy, Emily Holman, tiene poquita información sobre todas las enfermedades subsiguientes. Hemos visto algunos cambios en la ciudad, pero por lo tanto, como dijimos anteriormente, que solo estamos al 8%, pero también hay unos datos que nuestro equipo ha dedicado algún tiempo para analizar nuestros casos y hoy queremos compartir que los casos del COVID entre dos grupos, entre las personas que son mayor de 65 años y también tuvimos un grupo de las personas que han salido positivas menos de 65 años. Entonces, nunca hemos visto una enfermedad contagiosa en tan rápido periodo de tiempo, en tan corto periodo de tiempo. Entonces, entre los casos de COVID menores de 65 años, la condición de salud subsiguiente más común es fumar o vapear, los cigarrillos electrónicos. Y ya sé que tengan antecedentes o que fumen actualmente. Representan casi los 30% de los casos. La segunda condición de salud subsiguiente más común fue la hipertensión o presión arterial alta, seguida por el diabetes y el asma. Como saben que especialmente en nuestras comunidades hay muchos casos de esas dos enfermedades. Para los que son mayores de 65 años, la hipertensión fue la condición de salud subsiguiente más común, seguida por el diabetes. En Long Beach, casi todos los que fallecieron a causa del COVID-19 tenían al menos una condición de salud subyacente. En el momento de la muerte, casi el 60% tenía hipertensión y poco menos de la mitad, 42%, tenían el diabetes. Lo que realmente queremos enfatizar es que las condiciones subyacentes son bastante comunes, no solo en aquellos que tienen condiciones críticas, están desarrollando una enfermedad grave o muriéndose por el COVID-19. Finalmente, también analizamos un poco más de los datos de hospitalización. La duración media general en un hospital de los pacientes con el coronavirus ha sido de hasta 11 días en el hospital. Estos datos confirman lo que nuestros funcionarios de salud han estado compartiendo durante las últimas semanas, que estamos viendo enfermedades graves en personas más jóvenes en comparación con las primeras en la epidemia y hay una amplia gama de condiciones y comportamientos que aumentan el riesgo de una persona en desarrollar este virus. Efectos a largo plazo. También queremos, aunque solo han sido ya 8 meses que hemos visto esta enfermedad brotar por nuestra ciudad y nuestro país, una nueva investigación muestra que puede haber un subconjunto de personas que tuvieron COVID-19 hace meses, pero todavía sienten los efectos. Esto incluye casos de que nunca estuvieron lo suficientemente enfermos como para ser hospitalizados. Los síntomas incluyen fatiga severa, confusión mental, falta de aire continua, dolor en las articulaciones, y también hemos visto que los pacientes hospitalizados se han experimentado daños continuos en los pulmones y el corazón, incluso después de haber sido dados de alta y meses después de haber sido hospitalizados. Si bien el virus aún es muy nuevo, esto es algo que también hemos comenzado a investigar. Todavía hay muchas cosas que no sabemos. Estos efectos a largo plazo asociados con personas con una enfermedad leve son otra razón por la que esto es algo que debe evitarse a toda costa. Por último, dado los datos que estamos viendo ahora y la nueva investigación que está saliendo, recuerde que los sacrificios que está haciendo ustedes todos los días, sea usando su máscara facial, mantenerse alejado de los grupos grandes, el distanciamiento físico, esas acciones que está tomando pueden salvar vidas. Si es tú o alguien cercano a ti, sigamos vigilantes y esperemos ver una nueva disminución en nuestros números. Muchas gracias por acompañarnos. Esto es todo por hoy. Y nos vemos aquí la próxima semana. That is all for today. Thank you so much for joining us, and we will see you next week.